Hello, my name is Srinivasa Kishore. I'm the Chief ENT and Sleep Apnea Head and Neck Surgeon here at Star Hospitals in Hyderabad. What is sleep apnea? Now, sleep apnea is a condition, obviously, as the name says it, is apnea, that is absolute blockage of breathing from the nose and mouth during sleep. So obviously what is happening is that the person is sleeping restfully in his bed, in his comfortable bedroom. But his need for oxygen is there, so the lung is trying to pull the air through his nose, but because of multiple obstructions happening at the level of the nose or at the throat, or a combination of nose and throat together, is preventing air from going in from the nose and throat. Now, if for 10 seconds a person is not able to get air into his lungs from the nose and mouth, it is called an apnea. If it is happening in sleep, it is called sleep apnea. Now, apnea is of two kinds, central and obstructive. The most common one is obstructive. Like I said before, by some reason, some kind of an obstacle, there is no air going from the nose and mouth because the obstruction is preventing the oxygen from reaching the lung. This is called obstructive sleep apnea, which is one of the commonest causes of sleep apnea. Sleep apnea, unfortunately, is not there during the day. So any kind of investigation you do during the day is not helpful in identifying or in managing this particular problem. Now, question arises, why should we even deal with it? Now, there are two problems that come with it. One is what we call as a neurobehavioral consequences, and two, cardiopulmonary consequences. Now, what are neurobehavioral consequences? Now, because of the air not going into the lung, the patient has to, or the person during sleep has to repeatedly get up during the sleep. So obviously the patient or the person is not able to maintain good quality of sleep. So what happens is when the person wakes up in the morning, one, he does not feel fresh. Number two, he might have a heavy-headed feeling. Number three, when he goes to the office, since he is not slept properly in the night, around 11 o'clock or 12 o'clock in the midday, he will invariably start falling asleep. To the extent that a person while traveling in the car, stopping at a signal might fall asleep, at a traffic signal might fall asleep. A pilot in charge of a big plane can fall asleep. A train engine driver or a school bus driver's judgment will be clouded because that earlier night, because of the sleep apnea, the person did not sleep well at all. So his mind is very clouded. His thought process is clouded. His decisions may not be correct. He may be, like we spoke, a train driver or a bus driver, or he can be a CEO of a company. Because of this inability to concentrate and his mind is clouded because of his inability to get good quality sleep in the night, he is not able to function well. His decisions will not be good. They will not be rational decisions. Slowly this problem will lead into memory issues. The person's personality will keep changing. The family members and his colleagues and employees will start feeling, why has his boss changed over the past few months? He's getting irritable, he's not taking correct decisions. And these are the ways that a patient actually presents to us mostly with neurobehavioral changes. The second most dreaded complication is what we call as cardiopulmonary complications of obstructive sleep apnea. Now here what is happening is the effects are directly to the heart. So when the lung tries to pull air against so much force, the air is now not going in through the nose and mouth. So obviously there will be a lot of burden on the lung and a lot of burden on the heart. This will cause problems like sudden heart attacks in the middle of the night, hypertension. Even if a person is having BP which was under control earlier, now after the onset of this disease, his BP will become uncontrollable, even with 2, 3, 4 drugs. And most of all, the most important thing is a person with sleep apnea has a 91% chance of a stroke. It could be a cardiac or a heart attack or a brain attack in the middle of the night, in the wee hours of the night, around 2 to 3 a.m. And that is the reason why sleep apnea, which presents to us as a simple snoring, which all of us used to joke upon, is actually a big problem. Such a big problem that the WHO has actually called it the disease of the century.